Policy Matters is a series from the Regional and Community Outreach Research Team at the Boston Fed, using data to illustrate the real or potential implications of policy for promoting equitable outcomes and economic security in New England and across the United States. When the COVID-19 pandemic unfolded in March 2020, widespread business closures and social distancing rules forced many to stay home, shuttering businesses and closing schools and childcare centers. Unemployment surged and concern rose about increased economic hardship. Swift passage of the Families First Coronavirus Response Act, the FFCRA, at the federal level in March 2020 provided sick and family leave to many workers so that they could quarantine, recover, and/or care for children during the crisis. Additionally, the Coronavirus Aid, Relief, and Economic Security Act, CARES, provided quick relief aid and dramatically enhanced the nation's unemployment insurance payments. Though the most generous provision of the CARES Act's unemployment insurance benefit extension, the $600 per week benefit supplement, ended July 31st of 2020, the federal government introduced subsequent fiscal relief at the end of 2020 and beginning of 2021 to ensure greater financial security and reduce hardship. In this Invested Policy Matters feature, we present findings from Columbia University's Center on Poverty and Social Policy that demonstrate the impact of federal relief on poverty rates by estimating what we would have expected poverty to look like across New England had relief not been provided, and showing estimates of actual poverty rates before and after relief was received. Across New England, CARES Act provisions prevented an immediate, dramatic surge in poverty. But a spike is evident in August 2020, when the most generous component of the expanded unemployment compensation expired. With additional relief in December of 2020, including $600 stimulus checks, $300 in a federal weekly unemployment supplement, and slight increases to the Supplemental Nutrition Assistance Program, SNAP, benefits, poverty rates stabilized and later declined. By January 2021, poverty was lower than the pre-pandemic year before. However, it rose again in April and May 2021. In July 2021, the expanded monthly child tax credit payments were distributed for the first time. Initial estimates suggest that these payments will make notable reductions in child poverty and should lead to declines in monthly poverty rates through the end of summer 2021. Differences since January 2020 in the overall poverty rate across the region mask racial and ethnic differences in how poverty unfolded across the pandemic. Reflecting pre-pandemic trends, Black and Hispanic poverty has been higher throughout the pandemic and persists at higher levels, despite the federal relief benefits. Asian and white populations also have benefited from federal relief, and poverty rates for these groups were below pre-pandemic levels in May 2021. With CARES Act relief throughout the pandemic, both working-age adults and seniors fared best, while children realized more notable growth in poverty rates. Children's poverty rates have yet to return to pre-COVID levels. Quick federal relief prevented dramatic increases in poverty. But this assistance did not reach everyone, and it is likely that poverty increased for some groups, including immigrant populations. And while some individuals and families were lifted out of poverty during this time, it is likely that others' income fell below the poverty threshold, representing some shifts in which individuals and families experienced poverty. This may mean new policies and practices are needed to ensure equity and assist families in achieving economic security over the long term.